Good afternoon and welcome to this live Roche-sponsored symposium, Building Resilience in Health Systems for People with Alzheimer's Disease, Early Detection and Timely Diagnosis in a COVID-19 World. I'm Jo Browning and I'm a Media and Scientific Communications Specialist, and I'll be facilitating the discussion this afternoon. The world is a very different place since the COVID-19 pandemic started to rage across the globe, affecting us all. However, COVID-19 has had an even greater impact on people living with Alzheimer's, their carers and families. And that's what we're here today to discuss. Our three main themes this afternoon are firstly to highlight the barriers that prevent people living with Alzheimer's disease from seeking a diagnosis. Secondly, to examine the broader health system challenges that prevent people living with Alzheimer's disease from obtaining a timely diagnosis. And thirdly, to harvest lessons from COVID on the role of innovation that could be used to support better detection and diagnosis of Alzheimer's disease. I'm sure we can all agree on the benefits of an early diagnosis, which opens the door to future care and treatment. We can't provide instant solutions to these complex issues, but we can provide insights, ideas, and inspiration to drive today's discussion and push forward towards people living with Alzheimer's disease and their families and carers having the best quality of life possible. There's a wonderful range of experience and expertise represented on the panel today, and we're also fortunate in having input from the European Working Group of People with Dementia, a fantastic partner working with different stakeholders from the Alzheimer's disease ecosystem, and who will be posing questions to the panel. So now it's time for introductions. We are fortunate in having a panelist with us this afternoon with complementary areas of expertise that between them cover the full range of experience about Alzheimer's disease. These are the disclosures of the panel. Firstly, we have Jayne Goodrick, an active member of the Carers Advisory Panel and Dementia Carers Count. Jayne understands more than anyone about the effects of dementia on the family. The word dementia didn't exist in Jayne's world until her husband, Chris, and later her mother were diagnosed with vascular dementia and then Alzheimer's. Her work is motivated by her own experience and that of her family to change what needs changing, to promote what works, to inspire others into their can-do attitude, and to bring hope where previously there was none. And representing the family doctor's perspective is Professor Jayne de Lepeleire. Former professor of general practice, Jayne has recently retired after a long and rewarding career spanning leadership roles. His research interests and teaching interests have included dementia, psychogeriatrics, mental health, palliative care, and the management of general practice. From the hospital side, we have Dr. Richard Perry, consultant neurologist and honorary senior lecturer at Imperial College and Imperial College Healthcare London, UK. Richard has been running several memory clinics a week for over 15 years, as well as pioneering the use of amyloid PET in early diagnosis and leading a clinical trials team specializing in potential new disease-modifying treatments. And finally, we have Sasha Bozeat. Sasha is the global medical lead for Alzheimer's disease at Roche, where she's responsible for supporting the CSF biomarkers, which are used in clinical practice, as well as the blood-based biomarkers, which are under development. Sasha describes herself as a passionate advocate for timely and accurate diagnosis. In addition to our panelists, as I mentioned briefly before, we're very pleased to welcome representatives of the European Working Group of People with Dementia. This group is composed entirely of people with dementia who are nominated by their national Alzheimer's associations, and they work to ensure that the activities, projects, and meetings of Alzheimer's Europe duly reflect the priorities and views of people living with dementia. They have met and identified a number of key questions for the panel. So, without further ado, I'd like to welcome Helen Rochford-Brian from the European Working Group of People with Dementia to share the first question to the panel on our first theme, the impact of COVID-19 on people with Alzheimer's disease and their ability to seek a diagnosis.
My name is Helen Rochford-Brian. I'm a member of the European Working Group of People with Dementia. I'm delighted to be here with you today to ask some questions which are relevant to us. I would like also to thank Roche for their support and great commitment to dementia and Alzheimer's Europe. And I certainly personally want to give a big thank you. From our perspective, during the COVID-19 pandemic, one important challenge was the GP consultations. They were only online, and many people experiencing memory problems and their families struggled to understand what was happening. In many cases, people were not able to get a timely diagnosis, or it was delayed. We would like to ask the panel, in their experience, what other challenges were encountered in the context of seeking and diagnosing dementia? What might be the consequences of this delay in diagnosis?
Thank you so much, Helen. Jayne, perhaps I can come to you first. As someone who has a direct line with many people living with dementia, including members of your own family, what other challenges have people living with Alzheimer's and their families faced in addition to online-only consultations?
Well, a lot of the difficulties the whole world, whoever was in lockdown, faced, we all went into a state of fear, a state of we need to batten down the hatches and wait for all this to be over. But what that did is that gave people that sense of isolation, and we didn't want to bother the GP. Now, while diagnosis just didn't happen for quite so many months during during the lockdowns, that actually meant that people were progressing without any support at all. For those that had a diagnosis, they were also having to manage without support at all. Now, the problem with that is we didn't want to disturb our GPs. We knew very much that there was this raging coronavirus out there, that the hospitals were struggling, that the GPs also, were overwhelmed by the patients coming to them. And we didn't want to bother them. We didn't want to go there with our small illnesses, never mind our large ones. And so it was that very stoical, no, we can manage, we'll do our bit and we won't put pressure onto the services any more than we actually have to. Now, the difficulty with that is that had a massive impact on the daily living for the carer and the person with dementia, because dementia, when there is a high stress level, the dementia becomes more apparent. We all become a lot more stressful when we're under high stress, but if you have dementia as well, then that becomes compounded. So not only was the person with dementia struggling with all this, their carers were also having to deal with this extra, the stresses that were on the relationship, whatever the dynamic of that relationship, be it husband and wife, parent, child, or even brother and sister. That, again, is not even taken into account for those people who were living alone. Those people who were living alone who may not have understood the restrictions that were in place, who may not have understood not to go out into the shop without masks, without hand sanitizing, the hands-face space that we had in the UK. All this created massive stresses on everybody. Now, if we're going to the diagnosis, then obviously the diagnosis wasn't going to happen. And that, again, puts the stress on the carer and also the person with dementia, because the people with dementia in the earlier stages know that something is wrong, but they don't know what to do about it. But if you can't go to your doctor and get answers, that makes it even more terrifying. So you've got the fear of the global pandemic, everything going on outside the walls, but the fear inside the walls was even more compounded by the fact that they couldn't get the help that they needed, by the very fact that they were trying to do their best for their communities and not disturbing the GP. That's one of the big things that I've noticed during the lockdowns.
I mean, it sounds like it was a particularly acute problem for people living with Alzheimer's disease and dementia. Jan, from the GP perspective, how has COVID-19 affected early diagnosis, and what were the consequences of the delay? Oh, I think you're on mute, Jan.
It's in line of what Jayne told. One of the big problems GPs had, that they were not allowed to do home visits, for instance, and that it was very difficult to do the observations that are needed in regular contacts to get an idea of the real performance of the patient, also to feel how the system with the family members and the carers works. So we we missed an important element of the tools we have to get an impression of the real functioning of the person. Furthermore, when we came to the idea, here is a problem, we need a referral for further specialistic diagnosis. These referrals all were totally impossible, were couldn't go on. So indeed, what Jayne told is that there was a delay of the process of diagnosis. And now in my country, I understood in UK it's maybe better at this moment, but in my country we're living now a very serious fourth wave, and once again we are afraid that the consultations for the gerontopsychiatric services and memory clinics once again will be as one of the first being postponed, because of course, yeah, it's not a question of life and death at this moment.
Mm. Richard, obviously this is going to have a knock-on effect in terms of the flow for referrals. What does this mean from a secondary care perspective for those seeking diagnosis?
Well, I think initially we saw a shutdown where all secondary services were switched over towards acute care and dealing with emergency care only. So there was redeployment of a lot of staff from certain clinics towards acute care and A&E and ITU, etc. There's a delay in people coming to us in memory clinics. And of course, following a delay, there's a backlog. There's a delay in investigation. So for instance, during the first pandemic, people weren't sure whether or not to split the MRI department in two, or to have a red pathway for this scanner and a green pathway for that scanner. So there was a lot of uncertainty in how to manage the situation to make it not just efficient, but also safe for patients or people living with memory problems or people with suspected dementia to actually come for services. And we found that what that meant was that people were living with uncertainty for longer. And I think that's one of the difficult things, is before people can get a diagnosis, that period of uncertainty can be very difficult because there's no management plan in place. There's no treatment or support because the diagnosis hasn't been reached. And it's a key part of that is to get clarity of the diagnosis so that we can start to help practically in terms of what's going to make a difference. And I think that period of uncertainty was very difficult.
Sasha, drawing on your scientific expertise and knowledge of diagnostics, how can technology benefit early diagnosis, and how has the pandemic hampered efforts in this area?
Well, over the last few years, there have been great advances in our ability to detect the pathological changes in Alzheimer's disease using imaging biomarkers such as amyloid and tau PET, and fluid biomarkers CSF, and then more recently in blood. And these tests have really become a standard part of workup in many specialist centres, which helps to increase the physician's confidence in a diagnosis. Of course, tests like this, in particular lumbar puncture, requires close physical contact. So understandably, we've seen a drop in the number of these procedures taking place during the pandemic. But there's another area where technology can also help us, and that's in the area of computerized cognitive testing and digital biomarkers. And here I think we've actually seen an increase in their use over the